everybody, I'm Dr. Laura David. I'm an NHS GP working in London, and I'm the founder of Smart About Health, which is a clinician-led health and wellbeing program for workplaces. And this month, April, is Bowel Cancer Awareness Month, and it's something that we all really need to be aware of to take charge of our health and wellbeing. And today I'm joined by Dr. Anisha Patel, a fellow GP and a bowel cancer survivor, and also an ambassador for changing the narrative. Welcome, Anisha. How are you today?
Yeah, I'm fine, thank you. Thank you so much for having me. And I know we haven't got long today, so I'm going to get straight to the point and talk bowel cancer. Bowel cancer is the UK's second largest cancer killer. And we know that one person is diagnosed every 15 minutes, so that's 42,000 people a year. What's really important to know about this cancer, it is the most preventable cancer out of all the cancers. So over 50% of cancers can be prevented. And we know that if people present early, that this is a curable cancer. So it's really important to know about the cancer and ways of using lifestyle to reduce your risk of cancer. People often think of bowel cancer as something of the elderly, but actually we know that bowel cancer is on the rise in young people. And in fact, I was diagnosed at the age of 39.
So Anisha, that might sound really shocking to some people that you were diagnosed at age 39, in the prime of your life.
I know.
Yeah, I think, as you said, it does often feel like this is something for older people, but it's also something we find really, really difficult to talk about, our bowels and our bowel habits. And even as doctors, you know, we've got all these other words for poo, like stools, and that can really medicalize things and create quite a barrier for people to getting help when they need it.
Yeah, no, I completely agree, but one of the things that I'm trying to do is challenge that poo is not taboo. It's something that we need to get more comfortable as a whole society in talking about, so that it empowers ourselves to go to the doctor if we've got a problem with our poo or our gut health. And that actually no one then dies of embarrassment. It's so important that we get people talking in all communities, in all cultures, and that facilitates things like even attending bowel cancer screening programs, where people are often embarrassed or feel there's a stigma attached to these types of things.
Yeah, and these are there to save lives. And as we've discussed just before, this is a highly preventable cancer, and some of these interventions like screening or understanding your risk and understanding what the warning signs are, this could save your life. So with that in mind, I would like it if you could share your story with our listeners, and hopefully it will resonate, and hopefully it will also resonate with other survivors of other cancers as well. Thank you.
Thank you. So I was age 39. I was a busy working mum of two. I was a GP partner, primary school age children, never stopping. And actually the first thing I presented with was tiredness. I went and had blood tests in January 2018, actually, so it was that bad that I actually made an appointment as someone who doesn't really go to the GP, but just to get my bloods checked. And actually at the time, everything was fine. And we thought nothing of it. I'm just busy. As the weeks and months went on, I started to get more IBS-like symptoms, or what people might call IBS-like symptoms. So I was more constipated. I was going to the toilet more frequently. My piles, in inverted commas, were playing up because I'd had piles after childbirth. So he was getting some blood on the tissue paper. But again, thought nothing of it because life was stressful, living, trying to burn the candle at both ends. And so I was just managing this myself. But when it came to probably July time, I spoke to my husband, who's ironically the lead for bowel cancer screening in London, and sort of said I'd had these symptoms. And he obviously said I should go and get checked, which I did do. And I had some blood tests again. We tried to treat the piles and the constipation symptoms. And I was told to come back in sort of 6 to 8 weeks if it hadn't got better. In fact, if anything, symptoms got worse. Yet I was running assault courses. I was still running. I was fit and active. I was feeling really well otherwise. And lo and behold, in Italy, when I was away on holiday, I felt that something was wrong, and I went back to my GP. They found me to be anemic, so my blood count had dropped by this point, and they referred me urgently to be seen. I don't think my surgeon, myself, my husband ever thought it was bowel cancer. We thought I might have inflammatory bowel disease. I am not stereotypically someone that has any risk factors for bowel cancer. I don't have it in my family. And actually, when I saw my cancer on the screen, I think the rest was history then. And I've had 2 major surgeries and chemotherapy since to put me in remission now for the last 3 years.
Thank you so much for sharing that story and experience. And I'm pleased to hear that you're in remission, and things are good for you. And I suppose that story might feel really close to home for quite a lot of people that might be listening to this. And one of the things that you picked up on there were sort of being at risk, and obviously age is a factor.
Yep.
But can you just explain a little bit more for people who might not be sure what their risk is in terms of other factors?
Yes, absolutely. So we know that out of all the cancers, bowel cancer is probably the one that's the most preventable. And it is very much related partly to a Western diet. So we know fibre has a huge impact. And in fact, a third of the preventable causes of bowel cancer are related to a low fibre diet. So that's something that we really need to try and educate people on, how we get more fibre in our diet. And actually, we need 30 grams a day. That's a lot of fibre. We know that processed meat and red meat contributes to bowel cancer risk. Alcohol, lack of exercise, being overweight, and sort of obviously a general gut health is coming into play as well. There's lots of studies looking into gut health as being one of the reasons why bowel cancer is on the rise in the young. So there's lots of lifestyle things that we could talk about and sort of help to make changes that are sort of consistent and that you can keep, not just for a week or so.
Absolutely. And I think there's so much that we could talk about in terms of gut health, and loads of great resources out there, which we'll also link into this video at the end. But I think some things that people often get worried about when they come to see me is actually just having that conversation about your bowel habits. And I'm sure it's the same for you as a GP in our
Yeah.
professional roles, that you might ask the question, how's your bowel habits? And people just go, fine. And actually, the conversation might not progress further than that. And I think we would really hope people can start to become a bit more able to speak about what's going on for them. So things like bleeding, things like change in your bowel habits, so more loose or more constipated, but often more loose, I think is really something people should be looking out for. Weight loss and tiredness, you mentioned. I mean, those are so subtle sometimes as well. You don't always realize they're happening to us.
Absolutely. And I think that's the thing. We know that there was a study done by Bowel Cancer UK called a Never Too Young study, and it was actually in a young population to look at what people thought about bowel cancer and how they perceived their risk. And what was really interesting is that a third of people didn't know the symptoms of bowel cancer, and a third of people actually delayed seeing their GP for more than 3 months despite having symptoms of bowel cancer. And about 3/4 didn't even suspect they had cancer when they were referred urgently. And I think what's really important is that we educate people on the symptoms. So there's a really good and simple acronym, which is Bowel. So B is for blood in your poo, or blood from your bottom. O is for obvious sort of change in bowel habit that's persistent, as you were saying, more constipation, more diarrhea, or alternating. W is for weight loss, for no apparent reason. E is for extreme tiredness. And L is a lump or abdominal pain. And actually, we really encourage people that if you're having those symptoms, keep a diary for 2 or 3 weeks of those symptoms and take it to your GP. It's really much easier for you and for the GP to then see what's been going on, particularly if you do find it difficult talking about bowels and poo. We know that people are often hesitant to go and see their GP when it comes to these issues. Stigma, embarrassment, fear. But, what we've got to remember is this is our job. We see it day in, day out. And in fact, 1 in 12 GP consultations are gut related. Not all of those are clearly cancer, but it's important that people come and see us so that we can take the history, listen to your symptoms, examine, do necessary tests, exclude things like cancer, inflammatory bowel disease, and then refer on if necessary.
And I think one of the points here is also people do feel embarrassed to come to the GP, but they're also worried about the examination part. So what would you say to somebody who was maybe experiencing some of these symptoms but was hesitating booking that appointment?
So I would say to them, you know what, one of the biggest steps is going to the GP. So just congratulate yourself getting to that first hurdle. And remember that actually we want to help you, and excuse the pun, get to the bottom of the problem. You know, we want to see where you're at. We want to make sure there isn't anything like cancer there. And we do this all the time. We're trained to do this. We'll talk through everything with you as we're going along. And we want to know that we're doing the right thing in terms of examination, the right tests, and getting you seen by the right person if need be.
Absolutely. I want to reassure people that you're in good hands once you've made that appointment. And that is the first step. Lots of people have a fear of judgment or that their problems might not be sort of necessary to go to the doctor. And we want to see anybody who's worried about their bowels. And those are the symptoms that Anisha has clearly described to us to help you, to help guide people as to what to look out for, because it isn't something that's front of mind for everybody.
No, and it's
So,
very much something that no cancer is glamorous. There is no cancer that is glamorous, but bowel cancer is often overlooked as one of the cancers. But in fact, it's in the top 5 in the UK, and as I say, it's actually one of the UK's biggest cancer killers. And this is definitely a narrative that a lot of us are working hard to change.
like yourself, so thank you very much for being part of this. One last piece, I want to relate this back to some of the work we do with companies, because after somebody's been on a journey, after being treated for a cancer like bowel cancer, but this isn't necessarily, related only to bowel cancer, is that there may be some specific advice that you can sort of give people in how they approach that return to work, and also the longevity piece, because doesn't just go away after the treatment. So I'd love to hear perhaps your experience and what other people that might be going through this could relate to.
Yeah, no, absolutely. I mean, I think the most important thing, having obviously returned to work myself as a GP, that actually probably it was one of the hardest things that I did, and don't underestimate it as an employee or an employer. There is very much a new normal that we talk about as cancer patients that we have to learn to deal with physically and mentally. And particularly with bowel cancer, there is an invisible disability that often lies with these individuals in terms of stomas potentially, or post-bowel surgery, altered bowel function. And what I think is really important is to have an open and honest conversation between employer and open employee, and keep those communications channels open with that individual. Because actually, life after cancer and returning to work is probably one of the toughest parts post-cancer. And it's really important that they've got the support in place inside and outside of work to allow them to rehabilitate back into the workplace.
That's such important advice. And for anyone who's listening who might be in a managerial position or a supportive position, just to open those channels of conversation and keep them open. I think that's such a wonderful way of looking at it, because this is something that may keep resurfacing for the individual psychologically as well as potentially physically. So that need needs to be addressed much more in the long term. What we wanted to do was to raise awareness of bowel cancer, to make it clear that it's not just for older people, that younger people can be affected, and sharing your really powerful story is a wonderful way of helping people engage with that, but also see the hope that it brings, that you are thriving in life now, and that you're able to contribute to the momentum of this journey of raising awareness of bowel cancer and how it can be prevented. So thank you so much for joining us, Anisha, and being part of this really important topic and journey. We hope that companies will take it on as something they talk openly about with their employees, not only to warn them of the signs and symptoms, but also to discuss the journeys people may have been on or may be going on, and also how that relates much more widely to families and communities. So thanks very much.
Thank you.